Thank you, Mr. Tallman. Dr. Evans.
Thank you. Good afternoon, Mr. Chairman and members of the subcommittee. Thank you for inviting me here today. I am Peggy Evans, Director of WIREC, the Washington and Idaho Regional Extension Center for Health Information Technology. I represent Qualys Health, a private not-for-profit healthcare consulting firm, and the Medicare Quality Improvement Organization for the states of Washington and Idaho. I am honored to be here today to tell you about how WIREC will provide vendor-neutral EHR adoption services to help healthcare providers attain meaningful use. Providers often start their EHR adoption believing that once the technology has been installed, they are at the end of their EHR implementation journey. In fact, once implementation has occurred, the journey has just begun. Technology is a great tool when it works well, but no matter how well it works, it is just a tool. Training people to utilize their technology is an essential component of successful EHR adoption. Our initial experience working with providers strongly indicates that there is a need for EHR technical assistance services through the REC program. For example, there is a community health center in the readiness planning stage of EHR adoption. They received a bid from a commercial, that is a non-REC consultant for services at $225 an hour for a total bill of $45,000. The cost of a commercial consultant was prohibitively expensive for a community health center, and they enrolled in WIREC, thus saving $45,000 for support of patient care and other administrative needs. Another story is that at our first site visit with another small clinic, we learned that the practice had not considered designating a project manager for their EHR implementation with only 6 weeks until their go-live date. While EHR vendors help providers with a bulk of their implementation and technology needs, providers often need to understand that there are tasks on their end that should be completed in order to help them help themselves, which is where WIREC steps in. WIREC's program strategy is threefold. First, we provide on-the-ground health IT coaches that deliver one-on-one customized technical assistance to providers. Second, we establish and maintain networked IT communities of practice to share learning. For example, we have implemented an EHR regional group purchase committee with an independent consultant who is facilitating the process and committee members supporting the work. Third, we plan to support peer-to-peer networking activities that will allow participating providers to learn from one another, a very powerful method of communication. Our WIREC staff delivers a suite of services to providers across the 3 stages of the EHR adoption continuum: selection, go-live, and optimization. For providers in all stages, we disseminate information about the CMS incentive payments, help providers understand the meaningful use criteria within a framework for reaching that level of EHR use, and provide assistance in workflow evaluation and redesign. The importance of workflow redesign cannot be stressed enough. Many providers are under the assumption that they will transition from paper to EHRs, but continue to use the same workflow processes that supported their paper-based records. But if they do that, they are unlikely to succeed with their EHR adoption. Health IT professionals and researchers have shown time and time again that workflow redesign is critical for successful EHR implementation and that it is not business as usual. Recognizing that providers in our region may have already adopted a multitude of EHR systems as a starting point toward meaningful use, WIREC offers vendor-neutral services and will work with providers regardless of their choice in EHR systems. Among the first several hundred providers who have enrolled with WIREC, there are currently 14 different EHR products already in use, which hopefully you can see displayed on the screen. There you go. I won't take the time to read them all, but you can see that there is a wide variety of EHRs that we currently support. Because one of WIREC's major objectives is to assist providers in meaningfully using their EHR systems, our consultants help identify the gaps between where the provider is now and where he or she needs to be in order to reach meaningful use. We then lay out a customized path for how to achieve meaningful use. We have received feedback from many providers that the meaningful use criteria just seem like a long list of unorganized requirements. WIREC staff provides a framework for organizing the criteria in a way that is more readily digestible by providers and their staff, and then suggests doable chunks that providers can tackle without being overwhelmed. To date, we have successfully enrolled practices that represent about 500 primary care providers, as indicated on the map. Among our initial enrollees, there is a distribution of practice locations across the two-state region that includes both urban and rural sites. The WIREC program focuses on smaller provider offices, community health centers, rural health clinics, and other ambulatory practices affiliated with the critical access hospitals and rural hospitals, and providers that primarily treat the underserved and uninsured. As you can see on the displayed graph, a vast majority of our enrolled providers are from smaller practices. Of the larger practices that we are serving, mostly all are community health centers or rural health clinics. The WIREC consulting team has now begun providing educational programs and direct assistance in the field to our participating practices. Initial survey results suggest that providers find REC services to be valuable. As you see on the display screen, among our practice sites thus far, 100% of the providers have reported satisfaction with WIREC services. The number of practices surveyed thus far is small, but the results are encouraging. Additionally, our educational webinar series for providers has been well received, with evaluation responses showing consistent ratings around 90% of respondents agreeing that each of the sessions has been of value, as indicated again on the display. In conclusion, Qualis Health's startup experiences show that providers across our region, both urban and rural, are enrolling into the WIREC program, and initial feedback from providers show that they are finding value in working with the REC program as a supplement to the support that they may receive from their EHR technology vendor. Implementing an EHR system and moving towards meaningful use is a transformation far beyond the technical aspects of implementing a computer system. WIREC looks forward to helping providers embark on that transformation through our vendor-neutral support. Thank you again for the opportunity to share our experiences.
Thank you, Dr. Evans. We're going to take questions now, and